Hello to our listeners. Thanks again for being part of the 20-minute clinic. Myself, Amit Paik, and we've got Paul Day.
Hello. Doing the comms, doing the wires, chipping in.
Always very much welcome. And look, today we've got a really exciting episode. Really pleased to have Professor Mary Morrell join us, head of the incoming Pears Cumbria School of Medicine. That is imminently about to launch on the time of recording. I'm so excited to be able to speak with Mary. I've had the chance to just spend some time over the last few months or so learning about the school and conflict of interest of being part of it. But I think it's a real opportunity for our listeners to be able to just understand a bit more of the journey of the school and hear really from Mary about her take on this journey. So Mary, welcome. How are you?
I'm good, thank you. Thanks very much for inviting me.
Absolutely fascinated by the journey that's gone on, really. But I suppose just for our listeners, for anyone who hasn't been aware of the journey that's come through, what was the thinking around a new medical school, a new partnership with University of Cumbria and Imperial in Cumbria?
So I think it's probably worth saying that we open next week. So in 7 days' time, this time next week, I won't be sat here. I'll be talking to the students. We will be admitting 58 students, and it's a 4-year graduate entry medical programme. It's a unique school because it's a partnership. It's not a school that's been designed by one university. It's been designed in collaboration between University of Cumbria, which is well known for training nurses, midwives, paramedics, lots of different professions, and Imperial College London, which is a research-orientated institution that has a medical school with just under 400 students in each year.
Wow. Good.
So what we're doing in Cumbria is very different. We are here because we know that it's an area which is under-doctored, and the agreement is that we set up a regionally focused medical school which trains doctors who will want to stay in the region. So it's really important to us that the programme that we've put together is a bespoke programme for the region. So we haven't taken a programme from London and put it here and expected it to work. We've tried to work hand in glove with local primary, secondary care, mental health teams to create a curricula that works for this area. Why we've done that? Well, as I said, it's an under-doctored area. It's also an area that doesn't have its own bespoke school. So obviously you've had students coming over from Newcastle, and we've got UCLan, and we've got Lancaster in the south. Yeah. But there isn't a group, an area, a focus here that you can say these are our medical students, these are the people that are going to work here. So that's the plan.
I mean, amazing to hear about this, isn't it? And you're so right. There is endemic workforce challenges. We all know that. Anyone who's listening knows about the challenges with getting doctors, GP registrars, and even GPs themselves in the area. So this feels like such a fantastic opportunity. What would you say has been sort of the journey early on? What sort of barriers or opportunities would you say you've kind of had?
Well, medical schools, as you may know, are you can't just open one. You have to get agreement from the government to open one. And because this one is, the technicality is that medical school places are capped in the country. And so to increase the number of medics being trained, you have to get agreement from the government to increase your numbers. So what we did with this school is we moved places from London to Cumbria. They're not new places. So we moved the paid students, and that was the first hurdle to get agreement to do that. The government then, incidentally, in the last round increase, gave us another 8 places. So we've got 58 now. And once we'd established that, we had to then work out the finances of it, because the money doesn't come until the students arrive paying fees. So we've been in start-up for the last few years. And in order to facilitate that, we were very lucky to have philanthropic support from the Pears Foundation, which is an amazing foundation. It's a property foundation, not the detergent. And they fund a lot of medical education, probably much more than anybody would realise. But they saw the potential in what we were doing, and their funding then enabled us to go through this startup period where we've been able to employ people, including myself, to be able to develop the school before the students arrive. So effectively, that meant it was done cost neutral for the government.
Okay.
Which what we're saying is that that's a very innovative way of doing things. We're the only medical school named after our sponsor. And all the time we're trying to look at how can we train differently, how can we do things differently so that we get a different outcome, which is doctors in the area.
Yeah.
Has it been a long time in the making then? It feels like this is something Cumbria's wanted for a long time.
So we got approval from the Secretary of State in 2022. We went through 5 Secretaries of State.
Oh, well, of course,
Because it was
yes.
during the time when they kept getting discovered in cupboards and various things.
Yes.
And so we just get to the top of the list and something would happen. And then it took a year for the 2 universities to work through all the legal aspects of and sign what's called a collaboration agreement.
Okay.
So we had an official kind of launch in 2023. So really we've only been in development for 18 months, which is a very tight time round. And I can't say highly enough the people that have been involved, both within the university, both universities, and the local clinical community. Everybody has come together to support us. It's been phenomenal. So
it's amazing.
Hats off to the community for
Fantastic.
supporting us.
That's one thing I want to pick up on, is that when you've gone around the region, the areas, and spoken to people, what's been that feedback on the ground from colleagues? Has there been much in the way of enthusiasm, or have you had almost barriers or obstacles along the way that way?
I think people were rightly sceptical when we first came because, what's Imperial College doing here? We've already got universities up here. Newcastle doing a great job, UCLan, Lancaster. So there was a lot of conversations about why we're here, what is it that we're trying to do. And obviously from the future students' perspective, what can they get out of being here? We're a graduate programme because the evidence is that students are more likely to stay if they're graduates. But they might not.
Yeah,
We don't know. I mean, if you bring me back in 4 years' time, I'll tell you whether they've stayed or not. And then there's also a conversation about the pull-through training programme. So even though we might train them here, they might have to go away for specialism, and that's the time when they might be wanting to settle down. So we're very much now focusing on the pull-through training programme. Once we're open, that's where we need to put our energies. So my view is that we're more than just a medical school. We're actually looking at what does it take to transform the delivery of healthcare professionals? How do we recruit? How do we train? How do we retain in the region? And I think that narrative is the one that's got through to people.
Okay.
Because, if I just wanted to train medical students, I could have stayed in London. And they do it very, very well in London. They're training clinical scientists of the future, whereas I think this regional programme is very much about training other kinds of focus, which is not... I'm struggling a little bit because sometimes people say, well, that means that they're not as good or they're not the same.
Yeah.
But the needs here are different, and there's no point in trying to claim that all parts of the country are the same, because they're not.
I suppose what would be expected from our students and prospective doctors from a Cumbria perspective compared to, say, London? How do you feel as though the school could go about their education differently?
I think there are amazing opportunities here around innovation.
Yeah.
So because the community works together, I think you can innovate to do things differently. And because we're only a small school, there's only 58 students at the moment, we can change things nimbly. So if we find that actually this is an area that people are interested in, then we can move into that area. So innovation, very much the case. And also being independent, being able to make decisions, thinking about whether you treat, whether you transfer, what is it, how is it that was going to work best for those people in their locality. So very much being focused around that community secondary care pathway rather than just focusing on your small area.
Fascinating, isn't it? Really. I suppose the other thing about this is medical schools arguably are often a lot of their placements kind of occur in hospitals. Yeah, so they'll end up seeing the breadth of hospitals, and I think from it's increasingly changing that the students get a chance to spend more time in primary care. From your point of view, how was the school almost engineered their primary care placements? Just for interested colleagues out there who's listening, go, how much exposure are we going to be able to get our students in the communities and into primary care?
So it's a 4-year programme, and they will sit the medical licensing exam at the beginning of year 4, because they have to then have an opportunity to need to resit it and things before they finish. So that means you've really got 3 concentrated years before you go into your final year. And at the end of term 1, the students will do a short secondary care placement in the infirmary in Cumbria, in Carlisle. And then in term 2, they'll be on primary care placement.
Wow. Okay.
So they'll start here next week, and in January they'll be in placement on primary care.
I suppose that the opportunities then, as the years progress, there's more and more opportunities to have placements.
Yeah, and then so they do that for term 2, and then in term 3, they've got a secondary care placement in Finesse General.
Okay.
So they're going across the whole county, so they can see different healthcare delivery in different areas. And then in year 2, the students will be split, half in the north, half in the south. Yeah. And they'll be in both primary care and secondary care placements throughout the second half of year 2 and into year 3.
Amazing. I mean, so they will have the opportunity of being able to spend time and learn from the communities that they're hoping to stay and work in.
Yeah, I think you've got to also, though, be realistic that there are things they won't see because of it being a sparsely populated region and the transfer of some specialisms. And that's where being a collaboration with London helps, because we've got a conduit down to London to support things that aren't necessarily that familiar in this region, which is not to say they're all going to get on a bus and go to London. But they will be able to benefit from the experience of other clinical colleagues in London. And then I think the second thing that you've got to think about is the whole training environment. So the pressure on training both undergraduate, which even though it's a graduate school, they're undergraduate medics, and also other specialisms. So I know in GP training, you've got to weigh up whether you didn't take medical students or whether you're going to take GP trainees, and space is always the issue that we come up against.
Absolutely.
If it's not money or time, it's space.
I was lucky enough to get a tour of the facilities, and something the listeners might not know is how impressive the kit is. That what you would call it?
The simulations.
The simulations.
There we go.
Yeah, the simulations that they've got. It's very hands-on by the looks of it. The technology looks amazing.
So a lot of new medical schools start off with new buildings. We elected not to put our money into new buildings. We elected to put it into people so that we could set the school up. And also the University of Cumbria already have training facilities because of their nurse training and their occupational therapy and things like that. In terms of simulation, you have to have a mixture. So everybody recognises that simulation is a really valuable way of training, but it's not a substitute for interacting with patients and seeing surgery and things like that. So we want to make sure that we're doing both.
Our incoming students will have a brilliant opportunity to be able to learn through simulation, and I suppose set them up for that early clinical exposure. So really good to know. Anecdotally, feedback I've had from colleagues, and again, if this is sort of questions being had from our listeners, but capacity for these placements. We know practices, I mean, we've got GP colleagues almost in cupboards, haven't they, trying to turn a hot desk under the stairs and whatnot, trying to do their best with what available space. How has that challenge been looked at from the medical school? Have you had much difficulty with getting placements in primary care that way?
I think my experience of primary care in the north of the county is how innovative you are. And also collaborative. I mean, from the beginning, you've all been willing to come up to the campus in Carlisle and talk to us about what is possible. And I think through a process of conversation, you can usually work things out. Okay. And then what we've been looking at is whether we can generate more space by creating, again, coming through with innovative solutions to create new ways of training students. And we're not quite there yet with all of those ideas, but working together is one of the joys of being involved with this medical school, because we're relatively small and we're focused on the region. We know each other, we can have conversations, And so obviously there are people who can step forward more quickly because they're better resourced, the practices, their things are working more seamlessly, and they will be able to come on board with us. But then we might be able to reach out to other areas where things are a little bit more difficult at the moment and help to try and support. We are absolutely here for the region. We're here to put energy into the system, not take it out. And I can't think of a better way of putting energy into the system by, recruiting students to come and be part of what we're trying to achieve here.
Fantastic to kind of hear that there's that thinking about innovation to try and, I wouldn't say fix, but at least recognise an issue and be able to create solutions collaboratively. Really nice.
It's tough. The environment at the moment is really, really tough, and our students will be needing to understand how they can work in that environment. But it's also a beautiful environment. The environment is stunning, and being trained to be a doctor is a tremendous privilege to be able to work in these situations where people really need that support. But doing that day in, day out can be really exhausting. And so how can we support the people who are already here? I don't know if we'll be able to do all of it, but if we don't give it a go, we won't know, will we?
This is it, really, isn't it? So the fact that we've already got this far is fantastic to see.
How does this compare to when you were training as a doctor then, back in the day?
Oh, well, come on, back in the day.
I know, you're still very youthful, it's hard to tell. Yeah,
obviously. No, I think, I trained in London at the time, so again, different place and different sort of environment set up. I was just thinking about my primary care placements, and they were there, they were happening, but very much kind of in the back of the room, shadowing, maybe the odd opportunity to spend time with patients and whatnot. This feels as though there's very early clinical exposure and very early clinical exposure into primary care.
I'm very Cumbrian based, like
absolutely,
saying.
I think most medical schools are not 58 students, so it will be different because it's smaller. The students will be known, but we'll learn along the way. We'll need to change things as we go along, and we'll definitely learn along the way.
What's the plan then for? Because we spoke about the journey of the school, the arrival, the thinking behind it, the support we've had. Just from sort of almost next week onwards, really, what's the journey in your mind about our students landing? What support could or should we be offering in North Cumbrian primary care to ensure that our students have a really good experience?
Yeah, I think you should be really nice to them.
It's on you.
Look at me. I'm lovely, God.
I mean, you stay away, you have a good time, don't you?
Yeah.
But in recognising that there are challenges in all disciplines, and we will do our best to support them, and ultimately then they get to choose. Yeah. There are a majority of students are from the north, and there are a significant number of them that are from Cumbria.
Oh, brilliant.
But from the whole county, not just Carlisle area, we've tried to embed it within the clinical environment, so both primary and secondary care. So it's not my medical school, it's our medical school, it's your medical school. And whether we succeed will be down to all of us working together. They're your colleagues.
Yeah.
These people are going to be your colleagues. They're going to be your future consultants. So how do you want them to be trained? And if what we're doing doesn't work, come and tell us.
Okay.
So that's what my request is, that we work together to make this project happen.
Yeah.
That it isn't something that's done to you. Because having choice and having flexibility and being involved with something, I think, is the way to make it sustainable into the future.
And just picking up on that future point then, you've spoken about the vision of 2029, increasing our numbers in due course once we're ready.
Yeah, the requirement to increase the numbers it's not like an absolute, but it just means that there's a little bit more flexibility in the system. What we're trying to do is to create a medical school that's community focused, and whether that is, along the whole pathway from primary care, secondary care, so that people understand that community aspect of what we're doing.
What's your vision? What's your roadmap of, I don't know, the next 5 years, for example? About where would you love the school to
So the vision for the school is to improve the health outcomes for the people of Cumbria. And that means that how we feel that we can do that is, first of all, to attract and retain medical students that stay in the region. The second thing, which I haven't really spoken about here, is to foster a research-focused environment. So people are thinking innovatively, they're thinking about how they can develop their practice, they're looking at new ideas of treatment, etc. Government's talking about analogue to digital prevention, those sorts of things. And the third arm of it is to support the educators in terms of their training and allowing them to have a community of practice, people who come together, who want to make a difference with the education.
Really fascinating, novel ideas. And areas that haven't been touched as much as we'd like to. Research is a great example. Fantastic.
It's all positive stuff.
Absolutely.
For the region.
Mary, look, really good. One last one that we try and land with all our speakers.
He loves asking this question. It's
finale. This is what we've asked everyone so far, haven't we?
We need a montage, I think.
Absolutely. We'll Christmas special hashtag. The question really is about, aligned to the med school or the NHS, what one thing would you feel as though would be beneficial to be able to improve the experience of working within your sector or the NHS that would overall benefit patient care?
From my perspective, it would be for people to recognise how special the care that's free at the point of delivery is. And so therefore we all work hard to look after it, because it's so important if you or somebody you care about needs that health care immediately, not to have to immediately worry about the finances of it. I think that's a tremendous gift that sometimes this country takes for granted.
You know what, it's so refreshing. And look, completely agree with you, because everyone talks about the money, the challenges and the resources, but you forget actually at the end of the day, such an entity and how precious it is to be able to have that. Colleagues around Europe, in the US, we have to fork out your credit card before you end up thinking about that.
You have to consider, in other countries, you have to consider insurance. You have to consider your insurance package in a way that we don't. Now, maybe we should, and obviously we need to look at other ways that the NHS can run, because it isn't working at the moment. But to lose that free at the point of delivery, I think would be, and a national insurance system, I think would be a dreadful loss.
Fantastic. Lovely to get your insights, with that, but also just fantastic hearing about the medical school. Again, my personal sort of view of it is I've watched it initially at a distance and observed how it's gone through. I've been much more closely involved recently and absolutely bowled over by how much innovation and excitement there is for the school. And actually, this is that paradigm shift that we've talked about for years, decades, for our colleagues longer in the tooth than I am, about what can we do about improving healthcare in our region. This is a real cornerstone for it. So look, Mary, just absolute pleasure having you on board. I absolutely look forward to having you back on, if that's okay, just over the coming months ahead to hear about how the school's progressing.
Thanks very much.